Hi, and welcome back. Happy New Year to our January edition of Sisterhood in Surgery. And today's topic is imposter syndrome. Friend or foe? Is it a bad thing, or can you actually make it a good thing in your life? And today we have two great guests. Our third is actually, I think, stuck on a plane right now, so I don't think she'll make it. And of course, my co-host, Palma Shaw. Remember, this is a live show, so please send in your questions. You can join by web, go to pollev.com, enter DeBakey, send us your question, or you can join by text DeBakey to 37607, and we'll get your questions answered. I will start with introductions. I have the prestigious Dr. Allison Halliday, who fortunately got out of jury duty, but graced us with her presence at 11 p.m. her time. So thank you very much for being here. She's an emeritus professor of vascular surgery at the University of Oxford. She's the past president of the European Society for Vascular Surgery. Of note, her bio is very long. We try to trim it for time's sake to include the notable events, but she was the principal investigator of the world's largest international randomized trial in vascular surgery, if anybody's heard of ACAS 1 and 2, influencing national and international stroke guidelines and worldwide stroke prevention. She's also collaborated in the 2017 and 2022 ESVS extracranial vascular disease guidelines, 2019 ESC dyslipidemia guidelines, 2021 ESOC carotid guidelines. She's authored over 150 peer-reviewed publications. She's a strong advocate for European collaboration and for equality and diversity in vascular surgery. Welcome, and thank you for being here in the middle of the night.
Great to be here. Thanks, Yopal.
And it's my pleasure to introduce Dr. Beth Woodward, who I met at the European Society for Vascular Surgery meeting last year, and it was wonderful to meet her. And I instantly said, you need to come on our show, because she's from Canada, and she's a family physician who actually is focused on full-time psychotherapy practices. She graduated medicine at the University of Ottawa and did a family practice residency with an area of specialty in psychotherapy at the University of Toronto. Since graduation, she had continued her education in mindfulness, meditation, and cognitive behavioral therapy, and she's a licensed facilitator in mindfulness and mindful eating. Along with her psychotherapy practice, she also runs courses in mindfulness and meditation and in mindful eating. She lives in Toronto, Ontario, Canada, with her husband and 2 of her 4 daughters. Her outside interests include nature and all animals, especially sea turtles, and she was able to spend 2 weeks last year volunteering in Trinidad with the Sea Turtle Conservation Group, which sounds like a ton of fun. Welcome, Beth.
Thank you. Thank you so much.
Beth, too bad you're not going to the Southern, well, I don't know if you're going to Southern Association, but Alan Lemson is going to be president this year, so congratulations to him. That's next week, but one of our social activities is a snorkel with the turtles.
Beautiful. Enjoy.
Palma, do you want to start with
Sure.
what imposter syndrome is?
We should give a little bit of background. So imposter syndrome was first described in 1978 by Suzanne Imes, who's a PhD, and Pauline Rose-Krantz as an observation first among successful women and other marginalized groups. These highly accomplished, impressive individuals appear on the outside to have no apparent reason to feel this way, yet they still do. There are many potential detrimental effects on these individuals, including depression, anxiety, and other potential behavioral health issues. Imposter syndrome affects your internal feelings about your work or self-worth, and it can also actually affect the way you approach projects, relationships, or any other areas in which you're feeling insecure.
Beth, do you want to...
Go ahead, Linda.
Oh, I was going to say, Beth, since you do a lot of this therapy work, do you want to talk about kind of the key aspects of the syndrome? I know all of us in our prior conversation might have had moments in our life where we feel this way.
Absolutely.
But, when it would be really detrimental. And then we'll kind of go into what we think might be a positive aspect of it.
Absolutely, yeah. So, as Palma had said, it was originally sort of discussed as, a syndrome in 1978. And since then, there has been more research, including men in this area as well. And really, when we want to think about it, it is kind of a group of, characteristics. And you'll see that some of these characteristics actually make us good at our jobs, especially perhaps a vascular surgeon. So you'll see, why, and even as Palm explained, it was in high achieving women that the initial study was done in. So one of the things that is a really common trait is perfectionism. I don't think that surprises anyone, it's not just doing our best, it's everything has to be perfect. And if we, for some reason, hit our definition, then we change it. We just make it harder and harder for ourselves. This idea of superhero, you have to be good at everything and super and, can solve everything, and which is obviously, once again, impossible. We all have our areas of strengths and our areas that we may need some help. And a big part of it is, we see both kind of juxtaposition, the fear of failure and the fear of success. So you can see our fear of failure is so strong, we want to put up kind of like the facade. Everything looks great, everything's wonderful. And we put a lot of our energy into that facade as opposed to into, really could give us job satisfaction or success in our relationships or other areas. And then, finally, there's a big disconnect between what we believe intrinsically and extrinsically. So people would see us and perhaps see our accomplishments where we cannot. So we do not see our intrinsic value, and therefore we often look outward to get that validation. And we feel often like a fraud. And that's what comes up when you talk about imposter syndrome. So people believe that they've been lucky, they just happen to get a job or a position, and that people are going to find them out. And that's kind of at the serious end of things. It's obviously absolutely completely normal to be nervous or anxious in a new job and a new task. But once again, this takes it to the point that our energy is not going into things that are actually productive for us. Unfortunately, the energy is going into these negative aspects of the syndrome.
Allison, what do you think? You've been a vascular surgeon for a little while, and you've certainly had many, many high-level accomplishments. How do you perceive imposter syndrome playing a role in vascular surgery in your career?
Yeah, I think it must particularly have a role when people are finding it difficult to actually climb the slippery slopes to get through training and to get to be specialists, and they have to look around at their contemporaries. And of course, if we all worked in a very friendly and non-competitive environment, well, that would be just great, but that isn't how it is. There's a lot of bullying, there's a lot of intimidation that people don't talk about, and there's a lot of pressure, not just pressure of work, but as you say, pressure of perfectionism and trying to actually perform as best we can, particularly for the patients. So I think, if you take as an example of that bullying, well, I can think of people who have been going along nicely, doing well, but the effect of bullying is to actually make them feel that they are an imposter and feel that there is something wrong with the way they're doing things. So I think people can be affected by their colleagues in these ways. If they're in a friendly environment and their colleagues are getting on well with them, then it's probably less obvious. So, yes, I think it's as important in vascular surgery as almost any other competitive line of business.
I think it hopefully is evolving now that there's more focus on wellness, particularly with trainees. I know we're spending a lot of time worrying about in the United States, and I'd love to hear what they're doing in Great Britain for the trainees, but we're focused on their wellness and their well-being and giving them support and such. And when I trained, which was about 20 years ago, I graduated, It was kill or be killed, eat or be eaten. I mean, it was survival of the fittest, especially as a woman. And you never knew in my program whether you were going to graduate or move to the next year. And there's a pyramidal program. So it's this constant sense of, are you good enough? Will you make the cut? And all of that pressure as you're trying to take care of the patients.
Yeah, I think that's true, because I've worked very briefly in the American system and in the pyramidal system, and it was certainly an interesting experience. But in Europe, the system now is generally that when you get selected, you will come out the other end of it. There isn't a pyramidal element to it in many countries. So you have got support, and the support is getting better. And there is more awareness of people actually trying to talk about how they feel. And of course, it varies from one culture to the next. So my guess is it's probably not the same, let's say, in Serbia as it might be in Switzerland or in Ireland. So I think it's probably quite different in different parts of Europe. But there's a lot more support than there used to be. I'm not quite sure how much people discuss how they actually feel about themselves, or how they feel about their work, or how they think they're performing. And I think maybe, Beth, that'd be something that you can fill us in on, because people think, am I doing my job well enough? Well, how good are they at actually discussing that?
Yeah, absolutely. I think, that has to be where the change has to come from the leaders. They have to be vulnerable enough to allow people below them to feel that they can ask the questions. I think that's why even a show like this is so important. We're talking about things. I mean, you three are all seasoned vascular surgeons, and you're thinking, okay, this is important. We need to talk about it. So that's a great, really way to have it. Any type of mentorship program, or a person that you can go to and talk to and be vulnerable and really talk about these things. Because part of imposter syndrome is building this facade. This is what I'm going to show to the world. So on the outside, you may look completely like you're feeling very confident, and so it's not something you can necessarily always see in people.
Do you think
so
imposter?
Sorry, I wanted to ask how you think social media affects that.
Oh, absolutely. Yeah. So once again, in all areas, we see this, starting from a very young age now, the comparison, what you're supposed to look like, what you're supposed to dress like, where you're supposed to live, where you're supposed to go to school. And obviously that will in turn move up. And there's things that are now seen and known about people that wouldn't in the past. So much, much more exposure. I think sometimes the expectations are so high that once again, success is almost impossible. You've always kind of secured your failure, with these high expectations that social media may lay out for you.
Do you think?
Not only that, it's like, look what I did.
Yeah.
So the social media was like, hey, I did the first to do this case in the region. I was like, you're like, big deal. And then you're like, well, geez, I didn't do that case today. And then you feel bad about yourself, like, oh my God, I'm a slacker, right? Not working hard enough, but then they only show you how great their life is, right?
Absolutely. Yeah.
5 other cases didn't go well.
Yeah.
But the one that went really well, they're broadcasting it all over X and, Instagram, et cetera.
Yeah. And I think hopefully we're educating yourself better. There's that tiny little slice you've seen of perfection, but the rest of their day could have gone totally off the rails. And I think more in us but it is easy when we're in that mindset. We're already feeling that we're an imposter to, not actually be able to really tap into our cognitive part of our brain, and therefore really start to spiral down and, not be able to really think clearly, like, hey, that was just 5 seconds or 10 seconds of their day. Who knows what else happened?
Yeah, and you mentioned failure and how important it is to fail, because if you don't fail, the fear of failure is far worse. So once you fail to, let's say, get a job you've applied for, which, most of us over in Britain used to find we'd apply for something and we wouldn't get it, and then you try again and you try again. It was a bit like Robert the Bruce in the cave, watching the spider, and you eventually got what you set out to do, or changed direction. But the fear of failure was far worse than the failure itself.
Absolutely. I mean, studies show that 98% of what we feel anxious or worry about does not occur. So there's a very small percentage, especially for people who are more prone to anxiety, that, and all that energy that goes into it. And obviously that imposter is going to feed into that worry. And once again, that can take up a lot of your energy and time. And, as you said, once you've gone through it and understand that you will live through it, it's a part of life, but that doesn't always come easy. Especially if we're in an environment that's not supportive, or that, only highlights the successes and doesn't really let people speak of their failures or their challenges.
So I don't know, Palma, whether you think that when we're talking about academic success, I mean, studies that are published are usually studies where you get a positive result rather than a negative result or a neutral result. So we all get this, the idea that really publication is success and positive results are success. So I don't know how that makes people feel when they're, let's say, pursuing an academic pathway and getting, perceiving themselves to not be getting anywhere, even though they are actually working well. What do you think?
Well, I come across that because I interact with a lot of incredibly successful colleagues in academics, and they may have published more than me, and I may have published more than other people. And I think the mindset has to be, we're all bring different things to the table. So someone that has 250 publications, first of all, did they change the course of vascular surgery? I mean, you could publish one landmark, look at the best CLI trial or something, or the ACAS that you were involved with. I mean, those are landmark trials and such. I mean, or you could have 5 papers that didn't do much of anything. It's just a number on your CV. So I think it's important, at least I struggle with that. So I say, what else do I bring to the table? Because for some reason, I'm in all these leadership roles, and it's not just because they like me, right? I mean, there must be a reason that somebody voted for me to be the recorder of the SCVS, or that I'm the president of the ISCVS, and I have to tell myself that. I have to say, and I may not see what that is. I may be blind to exactly what that is, and yet I say, well, but I'm here, and I have to tell myself that. And I think that's how I deal with my own imposter syndrome, right? And when I see all these people, instead of feeling like, negative about so-and-so being more successful than me or perceived more successful, I say, I'm so happy for that person. And that makes me feel better, right? Because I don't buy into that negativity, which I think can easily happen with all of this imposter syndrome, the cycle, the perfectionism, the over preparation. And I work so much harder than that guy. How did they get that,
So how does it, Beth, how do we develop this then? Because when you start out and everybody's doing the same job, and perhaps a guy looks more confident at something or appears more confident than his female counterpart, and they're applying for something. How has that come about when they start in this? They started at the same point.
Well, I think, you can look even back into childhood, and there's certain markers we can look for in terms of what, how you were raised in different environments. One environment can be you were told you were the very best at everything. And, as we know, then as our pool gets bigger and we become a smaller fish, it's a complete shock. And I've seen this over and over. I previously worked at a health services at a university, and see this over and over, these kids coming in completely traumatized because they've never failed. They've never seen anything like that. You can also see people who were very neglected in their families, and so they just never got any validation. They never actually built a good sense of themselves as well. And then as we enter, medical school training, you can once again see, as a female, in certain branches, it's very male dominated. So there is perhaps the internal expectation, I have to work twice as hard to be, given half the credit. And so it already feels like a bit of an uneven playing field. And that can develop from there. Unfortunately, sometimes in the workplace, there can be people who are ahead of us, and perhaps they are suffering from imposter syndrome. So they want to make themselves feel better for putting the people, the lower, the first year resident down or that. So you can see how it'd be kind of a combination. And when the environment is, fairly toxic, each person is almost like, as you were saying earlier, Palma, kill or be killed. So, the way I'm going to feel better is to make that person feel worse. And you can see that breeds a very unhealthy environment. And that's just going to almost be like a great medium to grow imposter syndrome.
And is this the reason? I mean, research shows that the levels of imposter syndrome are higher in ethnic minority groups. Can we go into that and why that is?
Absolutely. Yeah. So, even when we look back at the early studies were of high achieving women. There was a bias in terms of gender. There was a bias in terms of, education level, cultural, everything even. And we see that in a lot of research. And so, once again, there is underrepresentation. So you can see then that in that field, you are perhaps the only one, or there's been no one who's done it. So that can really impact the way you are. And sometimes they call it kind of like the guinea pig, or the person who's kind of thrown into an environment. And you have to represent all women, of your ethnicity, whatever it is. So the pressure is so huge with no one who's actually able to help you or mentor you. You're kind of an oddity. And once again, imposter syndrome, you feel alone. And so you can see how that would really, really increase, in a lot of those fields. And, there's some excellent research and very interesting. I can give you some articles after about this in particular phenomenon.
So do we actually learn as medical students now how to recognize this? Or should it be on a curriculum?
Absolutely. That's a great question. I'm going to look into that. That's really good. I have a couple of people who are involved in the medical curriculums in here in Toronto. So that's a great question, because I think it is important, and it could be something that we could start then, and hopefully then impact kind of the next generation and help them perhaps, be more mindful. And as we talked about earlier, what could then be the positive that could come for that? Can we turn that around so that they can see this as, now I'm empowered because I understand what those feelings are. And therefore, these are some of the things I can do to help myself, perhaps.
And beyond actually training, then presumably it also comes into the personal life, and it depends on the relationships that people have with their other half, or whether they're made to feel valuable as part of a couple, and therefore, if they have difficulties with that and feel an imposter because of their relationship, perhaps that would also impact on their work.
Absolutely. Yeah, you can see it's one of those things that can flow right from your personal life, your relationships, your professional, but also your personal relationships. And, speaking of women, we came up with this idea that women can do everything. And, we were supposed to be working, or not, because both are bad, and we have a family and we're raising children, and still in, these are Canadian numbers, but probably similar, I would think, to the States. 80% of household tasks are still assigned to females. So we have this huge kind of super power, super persona that we are still working through. And, that obviously is going to make us feel I'm not a good wife, I'm not a good mother, I'm not a good doctor, on and on and on. And really wear away or erode away at those relationships. And, then it's like, I'm 100%, I'm going to do this today. And then, everything doesn't work out. So we just feel worse about ourselves.
So we definitely generated one of these from the UK in, I think, the 70s or 80s, and that was Shirley Conran, who wrote a book called Superwoman.
Oh.
And she was married to the creator of Habitat, Terence Conran, who was a well-known designer. But she, I think, must have had some element of imposter syndrome, because she made an enormous name for herself by publishing Superwoman and showing how women can do all these tasks. And then actually people began to think they ought to be doing all these things. Mm-hmm. I don't know, what do you think, Palma?
Well, I think we're almost like two people, right? I mean, I'm a vascular surgeon, and then I have two children, and I raise the children, and then you feel guilty that you're at work late and I didn't make the kids, whatever, volleyball game or whatever, or I didn't bake cupcakes because I totally don't cook. But so, but I didn't bake cupcakes for my daughter to take to school, and her friend's mom doesn't work and she's at all the PTA meetings and networks, and I'm completely in my own silo, totally immersed in the world of vascular surgery. And you start to feel like, well, then I'm not a good mom. But I defy that. I say, no, I am a good mom, and who's going to define that for me? I'm not going to let these other people define that I'm a good mom or a good surgeon, because I take great care of my patients and my children are happy and healthy and love me. So I think that at the end of the day, that's all that matters, right? It doesn't matter how many cupcakes you made or how many volleyball games you went to or how many Valentine cards you helped them carve out. I mean, it's nice to do those things if you can. It's wonderful, but I don't know. That's how I manage.
What's the opposite of imposter syndrome? The reason why I ask that is because when Beth, you say 80% of the household, right? Like you're wearing multiple hats all at the same time. You have multiple jobs. I feel like we're underappreciated. I don't feel like I'm like, why doesn't anybody recognize that I am doing everything? And actually, the creator of Scandal and Grey's Anatomy, Shonda, right? I mean, she has this Shonda Land, right? She's executive producer worth millions, and she gave this speech about, just like you said, Palma, like, well, do I, go home and tuck my kids in, or do I go see, Sandra Oh do her last reading, and so she has to pick and choose. And she goes, but I don't feel guilty, because in the end, if I miss something for my daughters, they see that, look at what my mom's doing. Like, look at, obviously we don't have Palma Land. We should, but we don't, but she's like, literally, my daughters see a strong, successful woman. I have multiple shows. I, have a land that's named after me. Thursday night on ABC is my night, so she phrases it really well. But I don't know what the opposite of that is, of feeling, we should be more recognized for what we do.
Absolutely. And I think we just need to redefine some of these definitions, take them back. A lot of people are doing that. Right. It doesn't look like we thought it would, and that's okay. And once again, what are you modeling for your children? What are you showing them? I'm showing them that I can be a success in my field, and, and every family comes to some kind of balance that works on some days and doesn't work on other days, and that's okay too. And I think it's huge if we're allowing to see our children fail, They need to learn how to fail. And if we say, hey, wow, I screwed up, I missed that. Hey, let's talk about that. That's, a good beginning for them to acknowledge that failure is part of life and this is how we're going to work through it. And and that's another perhaps gift we can give them, just to show them we're not super people and we're not perfect. But, we're doing the best we can.
So we call it helicopter parenting.
Yes. Yes.
You call it the same.
Yeah, we do too. Yeah.
Absolutely.
Parents always hovering around.
In Asian culture, it's called the tiger mom. Like,
Yeah.
But this there's a sort of encouraging idea that parents should actually make sure that their children don't suffer the fear of failure and don't suffer from it. I don't see any indication that that's stopping. Or is that only on this side of the Atlantic? There was a man who wrote a book recently about how you should actually have your children fall out of a tree, because then they would know what it's like to, let's say, break an arm or at least have a shock, and then that would make them safer after that. But I still don't think that, for my children, I don't think I was a helicopter parent particularly, but every so often it crept in, and you felt pretty defensive. But you did want them to experience reality and benefit from that. So I don't see that helicopter parenting is stopping. Do you?
I feel like it's getting worse.
I would have to agree with you. I think too, we're pushing our children sometimes, some of us, unrealistic expectations, oh my gosh, I have to sign them up for the perfect preschool before they're born. It goes, in different societies and different parts of culture. And so there's that balance, I think, because sometimes we feel guilty if we're not helping them enough, or we feel guilty if we're helping them too much. But I do think there's a place for them to learn and become resilient and pick themselves up that is missing out in this helicopter parenting. And as I said, I worked at a university in health services, and so many of these kids were completely lost, or their moms would come in with them for the visit. And I'd say, sorry, please wait outside. I want to talk with your child. And that was shocking. And these were 19-year-old, these were adults. And, but just seeing the ramifications of that, unfortunately, and how harmful it was in terms of them seeing success, outside of their home.
Mm-hmm.
Well, they also might rebel against that controlling parent, So maybe we can talk a little bit of the ways that the positive aspects of imposter syndrome, like why, when we feel that way, why would we feel bad? It can generate a lot of anxiety, right, and a lot of depression and such, but maybe it's a mindset, right? All these things are just a mindset. And you say, I remember one of my mentors is Frank Veith, and one day I said, Dr. Veith, I'm on the fifth person speaking, and everybody's like made a mention of a part of my talk, and I'm like the last talk. And he said, I never worry about what anybody else is saying. And there's peace in that, right? There's peace in that. So you can decide that you're going to worry about every aspect. As each talk goes, you're thinking, oh my God, this is happening. Or you could say, you know what, that's too bad, and I'm going to give my talk and do it the best way I can, and I'm not going to let it eat away at me. And I think it's a mindset. And I think that management of imposter syndrome also has to be a way that you set your mind to deal with it, and you could twist it into a positive.
Yeah, absolutely. And I think just talking about it is so important. Just acknowledging that most people suffer from it. And therefore, for younger surgeons or medical students, just hearing that, okay, wow, I'm normal. Mm-hmm. But what we perhaps from the positive is to start to recognize, most of us have particular triggers. There's certain things that we feel are more perhaps likely to trigger that. So as we start to recognize that, we look for our patterns, and then we start to change the way we talk to ourselves, change the dialogue we have. We can tell ourselves a story that is completely untrue, but we start to notice that. And that's, one of the things I would do with my patient is, okay, here, take your phone, your notebook, whatever, write down what triggered that, and then we start to work on those things. And you can start to see, okay, this is sort of what perhaps a point where I'm feeling vulnerable, and that's okay. I realize that that's how I get triggered. And, this is now my awareness. So now my voice is not saying, oh my gosh, you're hopeless. Hey, okay, that's where I can ask for help. That's where I can talk to a friend. That's where I can talk to my mentor. There's lots of ways, rather than using it to trigger a negative, let's turn it into a positive. Can I motivate me to perhaps do some extra learning or different type of learning? Do I reach out to a colleague? So that's the way we can perhaps start to turn it into more of a positive.
So is it very dangerous then to be a vascular trainee with imposter syndrome? I mean, are you actually clinically dangerous?
I would think most people, and I don't have statistics for vascular surgeons, do suffer from imposter syndrome to a certain degree. Most of us have experienced it in our lifetime. I think then, there's that spectrum, as there are with most depression, anxiety, most, syndromes or challenges. So once again, how can we help to perhaps identify people at risk? And I think that's still what we need to work hard on. Just like we want to, look for people who are suffering from depression or crippling anxiety. How do I identify that? And once again, having a more open environment, we can talk about things that challenge us. We can talk about our failures. We can talk about our successes. And I think that would help then, not because the isolation of imposter syndrome, I think that's what can make it, more challenging, or as you said, more dangerous.
But I think clinically it can be helpful because, so for example, if I have a complicated case, like some complex endo or whatever it may be, I will go through every detail over and over and like plan A, plan B, plan C, and is anybody I know in the building in case I need help, and then the case, the case goes great. And you're like, well, that wasn't that hard. Everything went perfectly, but it probably went perfectly because I over prepared. And then that's like that forward feeding cycle, because we take care of patients. They trust us. Their lives are in our hands. We don't want to, not only do we not want to make a mistake in the case, you want a long-term durable outcome. You want every stitch to be perfect. You don't want to rupture the vessel. You want to, should I stent, should I not stent? I mean, there's so many decisions you have to make in one case alone that in the end of the day, you're not even 100% sure is right, and you have to make this decision. It's a lot of pressure on a person. So that just sort of forward feeds this whole imposter syndrome cycle that they talk about, right? Say, see, they did well because I quadruple checked this, you see, and I have to keep doing that now.
Yeah, but I think if part of that is I have experts, I have colleagues I can turn to, that's a really good way to turn outward rather than just turning inward. So I think when we look outside, then that can help us. And someone will say, oh my gosh, that was a really challenging case, or wow, this would be my experience. So I think that rather than spending all our time inside our own head, sometimes looking outward can be really helpful.
Well, I think imposter syndrome, or maybe, I don't want to say syndrome, but like moments of feeling like an imposter, I guess, motivates many people. I mean, because really, ultimately, why do you feel, like you said, why do you feel like an imposter? Because you feel like an outsider. You may not look like what you're trying to become, or traditionally, right? Like you don't look that certain look, or what not. But I feel like the more we succeed, hopefully in future generations there won't be so much of this feeling like, oh, like I'm faking it till I make it, or I don't look the part, or I have to work harder than the rest so that I can prove myself, since I'm, appear different or whatnot. So I think it's a positive thing. I mean, it drives Palma for sure to be successful.
It never ends.
Yep.
But, so I was hoping Beth would tell us some tips to how to manage it. So
absolutely, yeah. So
right up her alley.
I think one of the first things is just awareness, and that's what we've done tonight. We've talked about it. So people are much more aware. They're going to be looking for certain things. They're going to be perhaps more aware of certain behaviors. Because as you said, we can use imposter syndrome to motivate us to learn, or we can use it to, spiral downward and become just obsessed to the point that we're not really functioning well. So I think if we can start by just recognizing our own behaviors, understanding what it is, things that we feel anxious about are things we care about deeply. When we have a passion for something, that's more likely what we're going to feel anxious about. That's one of the big things I always say to my patients is basically that you're feeling anxious because this is important to you. And that's okay. That's really good, and probably you went into your fields because you felt very passionate about it. And so that's the good part of it. We can say, wow, I'm feeling anxious or stressed, but that's okay because this is really important. As you said, life and death. These aren't the typical things that a lot of people are dealing with in their job. So I think, when we look at it from that perspective, I do want to do my very best for my patient, but that doesn't necessarily just rely on me. I have a team, I have colleagues, I have people, I have mentors. So that idea too of, as I said, reaching outward and really, as you said, looking at your own mindset and looking at your own self-talk. Hey, I'm not sure about this. Great. I'm going to talk to so-and-so. Oh, I'm not sure about that. As opposed to, I can't let anybody know that I don't know that because they're going to think less of me. They're not going to think I'm good at my job. So, you can see, as you said, it's really important to look at things in terms of how I can move forward, how I can use this to motivate myself, how I can use this to learn. And I think ultimately, if you are able then to have a trusted coworker, friend, in different areas of your life that you can turn to, that's huge. If you can talk about it, basically imposter syndrome breeds in shame. And shame breeds when we don't talk about it. So the more we talk about it, the less, there's that huge kind of shame that hangs over it. So I think, just what we did today, that's going to set people's minds working, and hopefully they can take away one or two things. Just a tiny little bit in terms of mindfulness, just take a breath. Take a breath. When you feel, and you may get to know what the beginning of your imposter feelings feel like, great, take a breath. Okay, I'm going to catch myself. I'm going to catch that first sentence that I know has set me up in the past, and then I can take an alternative which I know is much healthier for me.
But is it more appropriate, for example, if you're not in a supportive environment where you can actually discuss it, to leave and to go to another job? I mean, should people be actually looking at jobs and saying, is this or is this not a supportive environment? If it doesn't look like it is, if it's just too competitive and every man for himself, so to speak, should I be avoiding a job like that?
Yeah, and that's tricky.
Yeah.
Some people may thrive in that environment. I think that knowing yourself and knowing how you can perhaps gain support outside of your immediate work environment could impact that. And I think, probably all of us have run into situations that were just not good, and that we probably eventually either had to move away in another area or move completely to a new job. So yeah, very, very complex. But I think if we start to look perhaps for what we need, and if I can't find it here at my job, I need to find it outside of my job.
Yeah,
I think it's important to develop your little nest of people. People like you could like phone a friend, right? Or like Crocodile Dundee says, "What do you mean I need a psychiatrist? Don't you have a mate, like a friend? Like don't you just have a friend to call,
Yeah.
And luckily I have people I can call sometimes, and I say, I've got this really hard case and I'm feeling like I don't know 100% what to do. And they'll say, of course you do. You can do this case. No, are you kidding me? And you're like, you think? You're like, yeah. I'm like, okay. So, I think that's hard. And I think that going through med school and the competitive environments, and I've been in super intense competitive environments where I didn't feel like anybody was on my side, and other places where people were, they want you to be successful and you feel that way. It makes a really big difference. But I think we can't just give 2 weeks notice and leave. So even if you're considering changing your job, you have to think long and hard about that in our position, right? So I think the immediate solution is to find a network of friends, just a couple people who understand what you're going through and that will be there for you and that will listen and that you can trust. It's so important.
Now, our College of Surgeons in Britain is actually very keen on supporting people operating together, and that's a big benefit. So that is something that I would say is probably only coming in the last 10 or 15 years. And of course, it means that when you operate together, you're not isolated in your own bunker, worrying about whether something turns out okay. Does that also occur in the States? Is there an encouragement?
Well, I think it's going to occur more and more often, because as we do fewer open, like for example, major open aortic cases, and it's getting regionalized, you have people that, you're doing fewer and fewer open aneurysms, right? So then it should be a 2 attending case at times so that everybody keeps current and that the patients do well. Because if you're only doing a third of the open aortas that you did 5 years ago, obviously you're going to get rusty. So 2 heads are better than 1. It's just hard when you're in a training environment, because then the trainees also, want to scrub and do parts of the case. And sometimes I'm like, hey, I have to do some too. I can't just give you this whole case because I'm doing fewer. So
also too with the RVU system here, right? Because you're not getting as many. You can't bill as much if you're an assistant surgeon. And Methodist has always been RVU system, but I've heard a lot of academic institutions are going more RVU based as well.
But I think at the end of the day, they want good quality. You want good quality outcomes. Patients have to come first. And if you want those cases to stay in the institution and patients to do well, and it requires that you have 2 faculty do the case and keep the care more local, that's something that the administration has to understand.
Yes, definitely should understand.
Yeah. So.
Well, we have a few more minutes. We do have one question, so maybe we can answer that and sort of give our last advice to the audience. Like Palma, I'm hard on myself and think it just improves my skills, but is there a time to draw a line?
I am like the wrong person.
I know.
I'm turning to Beth. She's my expert.
I would say just see how it's impacting your life. So if you're functioning well in terms of, your overall health, your mental health, your physical health, your relationships, but when you start to see that it is impacting your physical and mental health, that's perhaps where to draw a line. If you are someone who really thrives in that, and is really honestly doing well. But if you're spending a lot of your time and energy in terms of second guessing, overthinking in your head, there's a lot of energy going to those aspects and not necessarily to put into things like your actual job or your family or your relationships. That may be kind of a red flag to look for.
Great advice.
Think about coaching, Beth. I mean, I think a lot of people I've talked to have at some point in time we did coaching in my MBA class I took, right? And it was interesting. And I think that's a good way to get a neutral person who's a skilled observer to come into your life for a period of time, whether it's 12 visits or whatever that may be. And they may actually help redirect you to be more focused and eliminate some of your blind spots.
Absolutely. Yeah. I mean, when I was a young doctor, a talk that stayed with me was always, just remember, you take advantage of any help that you can afford. And that, I think, more and more has to be, what we need, not just everybody else around us. So investing in a coach, a therapist, whatever you need at different stages, I think is incredibly important. Somebody who can give you an outside perspective. Mm-hmm. And that's what I'm always talking to my patients about, because they're like, how did you see that? I'm like, I'm outside. You're in the kind of swirling chaos of your life. So having that outside perspective, I think, can be really helpful. And you're investing in yourself. And that's really, really important. Of all the things that we spend our money on, we may be actually investing in ourselves, which in turn then will benefit everyone around us.
Allison, do you have some final thoughts?
I just enjoyed it very much. I mean, I think we've been around a lot of things. We can't cover everything, but now I think we see imposter syndrome is part of the normal world, isn't it? So we should all really be saying, okay, you know, I welcome it, and I need to know how to use it constructively, like in perfectionism, and how to prevent it being destructive, and how to get your colleagues to get there with you. I think it's a very good. It's something we should welcome in a positive way.
Linda, any thoughts?
No, I just want to reiterate what Allison said. It was the fear of failure is scarier, right, than failure. Very good point. That you need to fail just so you can know how to handle it and move on, and that's a very true statement.
Well, I think they say fail fast and fail often, right?
Yeah.
Isn't that what the CEOs say? That's what one of my friends, the CEO, she said, fail fast and fail often. So I've been practicing that, right? Just keep applying for more committees and more societies. Stop. So I'm just going to run again. That girl again? She just doesn't give up. You know, so. And, you know, I tell my kids, I say, like, you know, I ran for vice president of SVS and I didn't win, but I'm so happy for the person that won, and I felt a little bit bad. And I tell my kids, like, because, you know, I'm like this surgeon in the family, right? And my kids, I don't want my kids to feel like I'm disconnected to where they are. I'm a normal person too. Like, I fail, but it's okay. And when you fail, to my kid, it's okay too, because you're just going to stand right back up and just keep on going.
That's right.
So.
Well, thank you for everyone for taking time out of your busy day and night to be here with us. And
just Allison.
Yeah, I know.
Good night.
I know.
Well.
Thank you.
Thank you so much for inviting me. I just so enjoyed having this marvelous time chatting with you smart women, and hopefully everyone can walk away just feeling a little perhaps more aware in ways that, you know, they can move forward and use, as you said, Allison, it to motivate us rather than to cripple us. So thank you very much.
Good night.
Have a good night. Thank you.